तेरी रहमतों पे है मुनस्सिर, तेरी रहमतों पे है मुनस्सिर मेरी हर अमल की कबूलियत। तेरी रहमतों पे है मुनस्सिर मेरी हर अमल की कबूलियत। ना मुझे तरीका इल्तिजा, ना मुझे शऊर नमाज है। So today we are going to start the pathology of respiratory system. Previously we have discussed about embryology. We have discussed in detail that in the embryonic stage how the lung bud appear during the fourth week of gestation period. Okay, and we have also discussed that lung bud originate from the endodermal lining of the zygote. Okay, and how the mesoderm play an important role in the development of the lung bud and the foregut. Okay, because mesoderm secrete the arachidonic acid, okay, and the upregulation of arachidonic acid will cause the generation of gene TBX4, and that gene will cause the formation of bud at the forehead. Okay, and after that we have discussed the anatomy, and after that we have discussed the physiology of the respiratory system, in which we have discussed in detail. In physiology, there are the total 4 points. Point number one, how the air comes into the lungs. This is the point number one. Okay, through which mechanism? Okay, and after that we will discuss how the air comes from the lungs, mean the exchange of gases between the lungs and the blood. 2 points. In number three, we will discuss how the diffusion of oxygen from the blood into the tissues and removal of carbon dioxide from the tissues into the blood and then into the out of the during expiration, how it is occurred. This is a 3 point. In number 4 point, we will discuss the regulation of respiration. These 4 points cover the physiology of respiratory system. Okay, so this is a quick review of embryology, anatomy, and what physiology. So today we are going to start about the pathology. Now, the lung pathology basically consists of 5 major diseases. Okay, which one? Number one, obstructive was restrictive lung disease. Obstructive we will call OPD. Okay, and COPD means chronic obstructive pulmonary disease, and restrictive lung disease. Okay, this is the point number one. And number two, pulmonary diseases of vascular origin. Number two, and number three, pulmonary infection, and number four, lung tumors, and number five, lesions. Lesions may be due to the pleural lesions or may be upper respiratory tract lesion. So these are the 5 points which cover the whole pathology of respiratory system. After that, the pathology of respiratory system finish. Lecture खत्म, pathology खत्म. Okay, आगे आप लोग पढ़ लेना. Okay, doctor Kirsa, now pathology finish. Now we will discuss each point one by one. Total respiratory system pathology consists of these 5 major diseases. Okay, obstructive, restrictive, pulmonary disease of vascular region, pulmonary infection, lung tumors, and lesions of pleural and upper respiratory tract. And for the two terms, okay, these are the atelectasis, and number two is chronic respiratory distress syndrome. Okay, these are the two some other terms. Despite these 4 points, other terms are atelectasis, atelectasis. What is the meaning of atelectasis? Atelectasis means collapse. Collapse of which? Bronchioles. Okay. Your name I forget. Dr. Usman. Okay. Atelectasis, जैसा कि नाम से ज़ाहिर है, collapse. Collapse of alveoli. Okay. In atelectasis, there is a collapse of alveoli. And this collapse cause a condition known as ventilation perfusion What is ventilation perfusion imbalance? Anybody knows about it? What is ventilation perfusion imbalance?
Ventilation is basically the stage of cases that is like we call them expiration and inspiration. If, for example, we have a mountain area, we have the less amount of like there is a less amount of oxygen level. So this is the disturbance.
Okay.
We call it
Okay.
hypoventilation.
Good.
But in hyperventilation, they have the excessive amount of like we have like the area where is the oxygen is and larger amount.
Man, you are very complicating the term. Okay. This is very simple. Ventilation, the movement of air into the alveoli. Okay. But you are discussing some other points. Mean at high altitude there is, I think, low oxygen level. Okay. And there will be the more red blood cells in our body for the compensation of low oxygen in the atmosphere. That's why Pathan's people are more red, more Karasmi than Punjabi people. That's why. Okay. And in this case, just ventilation is the movement of air into the alveoli, and perfusion is the movement of blood which is reaching to the alveoli. This is ventilation perfusion balance.
Yes, exactly, sir. But like you said, it hypoventilation. When I example like a correlation. For example, if we like consider the example, so it is better understanding like
Yes.
given mind. So in hypoventilation, we have like this example.
We will discuss this in detail.
Okay.
But now just keep it simple. What is ventilation? What is perfusion?
Okay.
Ventilation is the movement of air from the environment into the alveoli, and perfusion is reaching of the blood through the capillaries, okay, to the alveoli. Okay, so don't confuse between the ventilation and perfusion. But atelectasis cause ventilation perfusion imbalance. Why it cause ventilation perfusion imbalance? Because as we have discussed that the lungs will collapse. When the lungs will collapse, then there will be the low surface area for the gas exchange, and there will be the imbalance between the air and the blood. Mean between the imbalance between the diffusions of the gases. Okay, so there is a condition, it will cause inadequate oxygenated blood movement from pulmonary arteries to pulmonary veins. This condition is known as ventilation perfusion imbalance. Perfusion imbalance. Okay. So here one thing more, in the pulmonary arteries, from the FSC we have discussed that all arteries contain oxygenated blood except pulmonary arteries, and all veins contain deoxygenated blood except pulmonary veins. But here I am saying that there is inadequate oxygenated blood, mean the blood which is moving from the pulmonary arteries into the pulmonary vein contain less oxygen. Why less oxygen? Due to the collapse of the lungs, and this condition is known as ventilation perfusion imbalance. Okay, because the lungs contain less surface area for the gaseous exchange. Okay.
What is like the main etiology of this?
You are saying that what is the main etiology of atelectasis?
Yes.
Good point. Atelectasis is not a specific disease. Atelectasis is the first signs of malignancy of other major diseases like chronic bronchitis, like asthma, like emphysema. That's why I am not counting the atelectasis with these diseases. These are the main diseases. But this is the first sign of malignancy. You get this point?
Like this complication.
Yes. In case of chronic bronchitis, when there will be the hypertrophy of the mucous gland, then there will be the obstruction for the movement of the lungs. For the movement of the air into the lungs. Okay. And we also know that inspiration of air is very easy, but expiration of air is very difficult. Why it is happen?
Because they have the capacity and the lung capacity. So, for example, like which is not like our immune system is not properly work. So first of all, we have the regulation. For example, like we take season, then we have like the respiratory center they are not properly work. So they are like not easily.
This is not main point, Dr. Usama, Dr. Usman.
Yeah.
When we inspire, then our inspiratory muscle help to bulge out my ribs.
Yes.
Then when my ribs bulge out, then there will be the automatically lungs inflate. They also pull the lungs with themselves. Okay. Then what happened? Then air move easily from the environment to the alveoli. But during expiration, our muscles are not helping. And also, when there will be the fibrosis or any other underlying disease which damages the elastic tissue of the alveoli, mean the required capacity of the lungs, okay, then there will be the uh, let me draw a diagram so that you can understand very well. This is a alveoli, okay? Here is the elastic fibers which keep it inflated. But when due to any disease, due to any irritants, when these elastic fibers destroy, okay, then these lungs will not recoil. Then these lungs will not recoil. Then then the expiration will be difficult. देखिए ना एक मिनट ये स्प्रिंग है ठीक है एक स्प्रिंग है ये चेयर है इसमें स्प्रिंग लगा हुआ है इसके ऊपर मैं बैठता हूँ ठीक है बैठ गया स्प्रिंग नीचे चला गया अगर वो स्प्रिंग ही खराब हो जाए तो ये दोबारा वापस ऊपर कैसे आएगी वाली चेयर वो स्प्रिंग ही खराब हो जाए तो चेयर वापस कैसे ऊपर आएगी तो ऐसे ही जब ये स्प्रिंग ही खराब हो जाएंगे तो ये कैसे अपने आप को जो है ना दोबारा इंफ्लेट कर रखेगा ताकि जो है ना दोबारा अपने आप को रिकॉइल करेंगे ताकि हवा बाहर जा सके सो किसी भी रिलेशन में आना आसान है और जाना मुश्किल है ओके तो yes it is pathological condition due to any disease like in chronic bronchitis okay then there will be the damage of these elastic fibers when there will be the damage of these elastic fibers then the alveoli will not recoil and not force the air to move outside okay clear good now next so now we have discussed ventilation peripheral imbalance this is clear okay also okay now we discuss the types of atelectasis there are on the I am saying that atelectasis is not a particular disease it depends on the underlying cause that how the lungs collapse so there are three underlying cause on the basis of underlying cause we will classify the atelectasis into three types. Okay, number one is resorption atelectasis. What is resorption atelectasis? This is the main point I was telling you. What is the resorption atelectasis? Okay, now come to the point. Now types. Let me use a different color. Types. Resorption atelectasis. Due. What is resorption atelectasis? Resorption atelectasis is due to any disease during which there is a plug formation. This plug may be due to the hypertrophy of the mucous gland. Then there will be the more secretion of mucus, and the plug will be formed. Okay, and during that condition, the movement of the air from the environment into the alveoli will be difficult. Okay, so what during mucus or mucopurulent plug formation. If here is a suppose here is the hypertrophy of the mucous gland, and there will be the more production of mucus, then there will be the obstruction of the what movement of the air into the lungs, and the already present air here will be resolved. That is known as resorption atelectasis. Already present air will be resolved, but the incoming air will be not come inside the alveoli. Okay, this condition is known as resorption atelectasis. And during what condition this happen? During mucus or mucopurulent plug formation, or maybe any tumor formation in the alveoli tumor. And we will discuss uh, that during which disease the mucopurulent plug is formed. During chronic bronchitis, we will discuss now. Okay, during chronic bronchitis, chronic bronchitis. Now we will discuss the complete mechanism of chronic bronchitis. Okay. After that, the number two. This is the type number one. This is finished. And now type number two. Compression atelectasis. Compression atelectasis. Here, in case of resorption atelectasis, there is the obstruction in the of the lung of the airflow. And in case of compression atelectasis, as जैसा कि नाम से जाने compression मीन एल्यूलाई के ऊपर compression हो रही है, प्रेशर पड़ रहा है, किस चीज का जी? कोई भी ऐसी डिजीज जिसकी वजह से लंग्स पर प्रेशर पड़ता है, वो कौन सी डिजीज है? No, what is pneumothorax? What is pneumothorax? Pneumothorax is the presence of air and blood or any fluid into the pleural cavity. कहते हैं ना वो फेफड़ों में पानी पड़ गया ये, क्योंकि पेशेंट आता है फेफड़ों में पानी पड़ गया, उसकी डल साउंड आ रही है, जो पेशेंट जो है ना फेंट हो गया है, तो वो क्या होता है? वो न्यूमोथोरिक्स होता है. इसको हम डिटेल में पढ़ेंगे कि मेजर डिजीज है. ओके, न्यूमोथोरिक्स, कंप्रेशन एपिलेक्टेसिस. For example, pneumothorax. Any air, liquid or blood in pleural cavity. Here is the pleural cavity.
Right or not this one?
What are you saying?
Like you said it here, many pneumothorax we have to do it and after that. So they are should be right or not like
No, 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 no. Into the pleural cavity mean between the parietal and visceral pleura inside. Okay, this point we will discuss in detail. In pneumothorax there is the formation of plabs and bulla.
yes.
Due to these plabs and bulla, there will be the movement of the air, interstitial fluid. Okay, and also due to the damage of any artery, the movement of the blood into the pleural cavity. Okay, we will discuss in pneumothorax in detail that how the bulla and plabs are formed. Any air, liquid or blood in pleural cavity, कौन सी disease होगी जी?
Pneumothorax.
Pneumothorax. Just enjoy the lecture, guys. Pneumothorax. लाइफ में से बहुत टेंशन है, enjoy करो lecture के पास.
Yes, sir.
मैं खुद भी enjoy करता हूँ, जब मैं खुद भी पढ़ता हूँ तो मैं enjoy करके पढ़ता हूँ, है ना मैं खुद भी enjoy करके पढ़ता हूँ, आप भी enjoy करके पढ़ें. अच्छा जी, क्यों डॉक्टर अहमद? डॉक्टर अहमद लिखने में बिजी है भाई. लगता है डॉक्टर अहमद पहला कोई टेस्ट जो बढ़ गई है. Okay, number 3. Contracted. This marker is not working. This is also not working. Contracted. Contracted atelectasis. What is contracted atelectasis? First is resorption, mean any plug formation, air will not come from environment to the alveoli, and there will be compression from the outside. And now third one is the contracted, mean the lungs will be, the alveoli will be contracted. How the alveoli will be contracted?
Because of pressure?
No, 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 no. Because of fibrosis.
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 Volume.
जंग लग जाएगा.
Volume of the fluid level will change.
Yes, yes.
Increase their size.
फेब्रोसिस की वजह से इनकी जो एक तो इनकी जो मॉर्फोलॉजी है वो डिस्ट्रॉय हो जाएगी, उनका साइज भी कम हो जाएगा, जो कंट्रैक्टेड फॉर्म में आ जाएगा. ठीक है, इसको जंग लग जाएगा. फेब्रोसिस. ओके, ड्यू टू फेब्रोसिस.
So you will try outside like alveoli will type 1 type 2. Alveoli type 1.
You are saying about the epithelial cell type 1 and type 2.
Yes.
Epithelial cell type 2, you know, type 1 epithelial cells are in more in number than type 2.
Yeah.
Because type 2 cells are very low in numbers. Okay, and they secrete the surfactant,
Yes.
like phospholipid. Okay, which maintain the surface tension of the alveoli. But in case of more type 1 will be destroyed, but less type 2, because less type 2 was already less in number.
Yes.
वो ऑलरेडी गरीब हैं, उनको और आप क्या बिगाड़ोगे, उनका क्या बिगाड़ोगे बेटा?
Control is important. Control role is
Yes, type 2 role is very important.
Yes.
Yes, because type 2 secrete the surfactant, and surfactant is very important for the
exchange of gas.
exchange of gases and also for the inflation of the
Alveoli.
alveoli. Okay. And type 2 cells also important because this type 2 cells conversate with the baby, with the mother
Yes.
in the embryonic life.
Yes.
That mama, now I am ready to come into the beautiful world.
Yes.
Okay. Type 2 cells.
I
also
have my own engine so that.
Okay. तो type 2 क्या सर क्या कहता है जी? ये बताता है जब सर्फेक्टेंट ज्यादा सीक्रेट होते हैं तो ये बताता है अपनी मम्मा को, पहली कन्वर्सेशन ही देखिए इस तरह ही करता है अपनी मम्मा के साथ कि माँ मैं अब जो है ना इस दुनिया में आने के लिए तैयार हूँ, इनिशियल प्रॉब्लम जो है फेस कर लूंगा, सांस भी ले लूंगा. वो यहाँ बड़े होते हैं प्रॉब्लम बढ़ती जाती है, फिर उसी हिसाब से बंदा थोड़ा अपने आप को डेवलप करता रहता है. ठीक है, क्यों डॉक्टर अहमद? आई एम राइट? We have discussed briefly in anatomy this thing. Okay. Now, उस्मान आपने मेरा पहले लेक्चर भी दिया, आपने नाम नहीं था लेक्चर में, तो ये आपको कुछ चीजें याद आ रही हैं ऐसा ऐसा है.
वो मैं पाकिस्तान में आई थिंक इस पहले भी अपने स्टार्ट की थी
हाँ.
फिजियोलॉजी तो मैंने वो ली थी. हाँ.
भाई यार इसको खत्म कर रहे हैं, दरमियान में थोड़े बहुत मैं खुद मतलब पेपर में थोड़ा बिजी था, और मामला आते बस वो क्लियर करके मुझे स्टडी करनी है,
Yes.
सारे कर रहेंगे। वैसे वाले कल को एक पेशेंट को डील करना है, कुछ अंदर होगा तो पेशेंट को डील करेंगे। मैंने मुझे वाले साहब ने यही कहा कि इमरान तुझे है ना सिर्फ हमें डॉक्टर नहीं चाहिए, हमें तेरे अंदर कुछ चाहिए। तो डीएल आप लगवा के नहीं आना। तो जब भी कॉल करता है यही बात करता है, तो कभी कभार बातें इनकी बातों को सीरियस लेना चाहिए। ओके, ड्यू टू फिब्रोसिस कभी कभी नहीं, बल्कि आप तो लेना ही सीरियस वाले बातों के इंशाल्लाह। अच्छा, फिब्रोसिस